Thanks for joining us on what is a very special occasion, and for joining us to listen to a very significant announcement that will be made shortly. I'm John Hudson, Chair of the Board of Directors of Northumberland Hills Hospital, and I have the honor of serving as the MC for this august group this morning. And I promise that we won't keep you in suspense indefinitely. But it is my pleasure to welcome as our first speaker this morning, Sheila Jarvis. Sheila is the President and Chief Executive Officer of Bloorview Kids Rehab Hospital, Canada's largest children's rehab center. And I must tell you that Sheila wears and has worn many hats in the healthcare industry in Ontario, probably too numerous to mention, and time won't permit me to list them all. But I can tell you that Sheila's experience and expertise in healthcare probably has no equal. She is here today, however, in her capacity as Chair of the Board of Directors of the Change Foundation. The Change Foundation is an independent policy think tank intent on changing the healthcare debate, healthcare practice, and healthcare experience in Ontario. You'll be hearing much more about the Change Foundation, both from Sheila and beyond her speech, about the Change Foundation in this community in the months ahead. Sheila, welcome.
Well, good morning, everyone, and thank you, John. I am truly delighted to be here today to announce a significant investment in this region by the Change Foundation. An investment to improve healthcare transitions, to improve patient and caregiver experiences, and to change, really change, how we go about it, with whom, and to what end. But first, a big thank you to you, John, for hosting today's events, and to our other happy hosts here at Northumberland Hills Hospital, and to your important partners, not in crime, but in healthcare design, who together make up the Northumberland Community Partnership. It is indeed a good morning. A good morning for the diverse leaders in this room who wouldn't accept the status quo of disconnected healthcare, who said we can and must do better. A good morning for family caregivers like Gail, who we'll hear from later. Gail's here in the front row, to share her own experiences so that everyone's healthcare might improve. So thank you, Gail. Most importantly, it's a good morning for the people of Northumberland, especially for seniors and caregivers who spend a lot of time trying to figure out how to navigate the ins, the outs, and the in-betweens of the many services that they or their loved ones need to manage their health and to stay well. It's an exciting day for the Change Foundation, too. We've been waiting for this day for about a year now, as we conducted what I'm sure the Northumberland Community Partnership will attest was a pretty grueling application process. Last June, we put out a proposal to see if healthcare providers and community support services in Ontario would or could come together with patients and caregivers to redesign transitions in healthcare. We didn't know what response we'd receive. Big, as it turned out. We received 27 responses to the letter of intent. We whittled it down to a short list of 5 who submitted proposals to an exacting RFP, and then they submitted their teams to a scrutinizing site visit. We clearly hit a nerve and a need, and a desire and a dedication to do something about it. The Change Foundation knew from the research, policy analysis, and engagement it had done since 2007 that there was a real need to fix healthcare fundamentally in Ontario, to connect and coordinate care in a sensible way to serve populations when and where they need help and health care. How to create an integrated health system in Ontario after decades of well-intentioned but one-off, uncoordinated changes in health care. We scaled that daunting challenge to a height that could be climbed. We figured tracking transition problems was the place to start. We focused on seniors with chronic health conditions because we knew, as you know, that people with chronic health conditions who interact most frequently and widely with the healthcare system are particularly poorly served in Ontario. And their care also happened to draw heavily on our healthcare budget. There's also the issue of our aging demographic, a reality reflected in this region above all others in the province of Ontario. And finally, but fundamentally, we said the project was driven by two objectives: to improve the healthcare experience of seniors and caregivers as they move in, out of, and across the healthcare system over time, and, importantly, to bring seniors and caregivers into the redesign work, using their experiences to help identify problems and solutions in healthcare transitions, and to see if their participation makes a positive difference. We believe it will. The Change Foundation, as John said, is a small think tank, but we have big ideas. And I hope, as you can see, we're also a think tank that does. We put ideas to work and into play. That's precisely what we're doing today as we announce $3 million for the Northumberland PATH, the community partnership that brings to life our trailblazing 2-year project called Partners Advancing Transitions in Healthcare, PATH, and a first with Ontario patients. So thank you.
And it really is a pleasure to be able to stand here today. As Sheila said, it has been a long time coming, and we at the Foundation have been sort of living this moment in our dreams for a good 12 months. So congratulations to every member of the Northumberland Community Partnership, and let me add my thanks to our host today for the event. So over the next 2 years, the Foundation is putting most of its money and energy into supporting the PATH project, because we think it will show there's a better way to identify and fix problems in how healthcare is organized. And we think the better way begins with using the experience of patients and caregivers as the driving lens for change. Imagine healthcare organized and delivered based on what patients say works for them. This holds promise for improvement not just for this region and its high percentage of seniors with chronic health conditions, but for the whole province. The Northumberland PATH is the first system-wide patient-caregiver co-design venture of its kind in Ontario. It aligns well with the patient-centered care emphasis in Ontario's Action Plan for Health and with the region's priority to build excellence in seniors' care. And we are confident in Northumberland PATH's ability to deliver on our strategic plan to improve people's healthcare experience as they move in, out of, and across Ontario's healthcare system. So why the Northumberland Community Partnership? It was a pretty easy choice. They identified an acknowledged need to improve transitions for one of the country's largest concentrations of seniors with chronic health conditions. They assembled a wide cross-sector community partnership with a strong primary care presence, an innovative technology component, and the active involvement of the Central East LHIN. They involve seniors and caregivers from the get-go and have partnered with the National Patients Organization. They have very strong leadership commitments and alignment within all of the partner organizations. And they have a measurement and data collection focus and have partnered with a highly respected university-based research group. In short, they showed the smarts, the heart, the team, the ideas, and the experience to make PATH a success. You heard our board chair say that we are a think tank that does, and she wasn't kidding. The Change Foundation will be very much part of this journey, as we are just as excited about the opportunities here as you are. We aren't wasting any time. Our first training session with the partners is in 2 weeks. Project progress and results will become available on our website as we proceed, so please stay tuned to the work here with the Northumberland Community Partnership to pave a new path in Ontario healthcare. Thank you very much.
Thanks very much. Sheila, thank you to you. Kathy, thanks very much. That's almost too much excitement for one day. Our next speaker this morning is Robert Byron. Is that you? Robert really needs no introduction around Northumberland Hills Hospital. He's been our president and CEO since November of 2008, and he'll proceed to tell you all about his side of this whole project. Robert?
Ladies and gentlemen, it's a pleasure to see so many of our partners here today to celebrate this wonderful announcement. We have the patient and client perspective, feedback we've received over the years, some through formal surveys issued by the hospital, some received directly as complaints, clearly reveals that healthcare providers are doing a poor job in coordinating their services and helping patients navigate a very complex healthcare system. And it's for this reason that Northumberland Hills Hospital has identified the need to improve transitions of care as a top quality improvement initiative. We also have the health system perspective. I refer to the Health Minister's recent release of the Ontario's Action Plan for Healthcare, which emphasizes the need for improved integration of services, the right care at the right time, in the right place. The Minister describes their plan as being obsessively patient-centered. Closer to home, our proposal is strongly aligned with the Central East LHIN's strategic priorities, which are anchored on the triple aim framework of the Institute of Healthcare Improvement. And they are improved care experience for our patients and clients, improved health for our population, reduced and controlled costs for the system as a whole. So what does this all mean for our project? Quite simply, it means we have a strong alignment, a strong appetite for change at all levels, from the grassroots level of our patients and clients that we serve, all the way up to system policymakers, funders, and planners. It's a shared vision and a commitment to redesign the system around the needs of our patients. The Northumberland Community Partnership brings together representatives across all sectors of the health system, from the hospital to physicians to community-based providers to health researchers and to the private sector, and most importantly, patients and caregivers. As the lead agency for this project, it gives me great pleasure to introduce to you the members of our partnership, all of whom have provided not only in-kind contribution toward this project, but a real commitment to achieve real results for the residents of Northumberland. I believe that we have representatives from all of our partners here today, and they are, in alphabetical order, the Central East Community Care Access Center, an agency responsible for the coordination and delivery of a broad range of services, including home care. CEO Don Ford will be speaking in a few minutes. The Central East Local Health Integration Network, our system planner, organizer, and funder. Their support is essential to sustain system improvements and to help spread the knowledge gained in Northumberland to other communities. Community Care Northumberland, a community-based organization responsible for the delivery of numerous services to those most in need in our community. The Golden Plough Lodge, a local long-term care home, bringing their expertise in terms of seniors care. Health System Performance Research Network, a research agency dedicated to improving health system through the measurement of outcomes. The Community Mental Health Services, a partnership between Ontario Shores Mental Health Sciences in Whitby and our hospital. The Northumberland Family Health Team, representing 21 family doctors and a range of allied health professionals. Palisades Gardens, a local retirement residence, also bringing expertise in terms of seniors care. The Patients Association of Canada, an organization dedicated to improving healthcare system through the eyes of the patient. They have already helped our partnership to think and act differently, and I know that they'll maintain that presence throughout this project. QOC Health, a technology provider already deep in research in finding better ways to improve patient experience in the delivery of care. And finally, the YMC Northumberland, an organization whose mission is to improve health and wellness for its community, including a range of programs for our seniors. Our partnership also includes patients and caregivers, because at the end of the day, it's all about improving their journey through this very complex health system that we offer. As equal partners, their contributions strengthen our project proposal immensely. Here today, we have two of the individuals who represented the patient and caregiver perspective. Ms. Gail Anderson, who will be speaking shortly. Can you just raise your hand? And we also have Hank Willis, who's also here, who brought forward the view that both providers and patients need to change their behaviors if we are to improve transitions in the system. Finally, I'd like to acknowledge and thank Helen Brenner, our Vice President of Patient Services, who was the executive lead, who pulled this partnership together and coordinated the proposal to the Change Foundation. Without your, where is Helen? She's here somewhere. You guys stand up. Without your leadership, we wouldn't be celebrating here today. Collectively, our partners have agreed. We can and we must do better. And I can assure you, we will do better. We are grateful to the Change Foundation for their leadership, insight, and support in making our shared vision a reality in Northumberland. And we thank you for placing your confidence in our partnership and community. Thank you.
Thanks, Robert, very much. It's now my pleasure to introduce a woman who has played a very active and enthusiastic role in the Northumberland Community Partnership. Ms. Gail Anderson has been introduced already, sitting in front of us. Gail was invited to participate because her family had an experience with the local healthcare system that was less than positive, and she spoke up. Rather than keeping her ideas to herself, she very generously agreed to bring her ideas and suggestions forward, and as such, she is one of the number of patients and caregivers who participated in developing the Northumberland Community Partnership submission to the Change Foundation. Gail, please come forward and share some of your thoughts with us.
Oh my goodness. Good morning. First, let me share with you, I am a daughter, a niece, a sister, and a friend, and a caregiver to many people in my life who suffer with chronic, life-changing diseases. This is an honor for me to be here today with you. I'm a little nervous, and I can't believe I'm up here speaking, so you know this is something that has gripped me, and I am so passionate and committed because I'm standing here doing this. But I am blessed. I am blessed to stand here before you, representing and advocating for patients, caregivers, and family members. It was not long ago that Northumberland Hills Hospital was my family's second home. This past October, my dad suffered an acute life-changing stroke. Combined with his multiple chronic health conditions, and my dad lives with 4 different chronic health conditions, his survival, his rehabilitation, and his recovery has been beyond challenging. I'm very grateful to share with you this morning that one of his transitions in the healthcare system was home. And my mom and dad are here today, and I'm very grateful. They're fighters. And when this was my second home, I met many, many fighters in this hospital, and we are fighters now alongside with them. I walked the halls of this hospital many days and nights, overwhelmed with feelings of uncertainty and anxiety. And I did speak out. But the most important thing, I was heard. From the very beginning of this PATH project, I was invited to be at the table and share my experiences, and that has been my privilege. I quickly became very passionate about every single senior, caregiver, and family member that must navigate through life hand in hand with chronic disease and illness. I also became very inspired and encouraged by Northumberland's desire to rethink this complicated system and to do it from the eyes of the patients. Let me share with you all, I am so not unique. I am not unique. My father's suffering and my mother's, their suffering, it's not unique. There are hundreds and hundreds of patients and caregivers that have had experiences leaving them isolated, confused, and uninformed about their healthcare journey. Imagine that. Uninformed about your own healthcare journey? I couldn't imagine it. I have to share with you, I couldn't. The challenges that we would face with my father, I couldn't have imagined until I lived it. And I couldn't accept it. And the great news, the Change Foundation and this community of healthcare providers could not and will not accept it either. What I've learned is when a loved one is sick, it's a time when we're the most vulnerable and when we need the right information and support. Seniors and caregivers must be part of the discussions to create this change. It's been my experience as I've gotten to know many patients and caregivers that we all basically want the same things. We want to be respected, informed, supported, and empowered when we need it the most. So thank you to the Change Foundation, Sheila and Kathy, thank you for realizing and acknowledging the commitment, the care and compassion that exists right here in this Northumberland community. Thank you. And it's also with 100% confidence I say this. And on everybody's behalf I say this. You have placed your vision, hopes, dreams, and investments in the right hands. Thank you.
Thanks, Gail, very much for those very inspiring remarks. Our last speaker this morning is Dawn Ford. Dawn is the president and CEO of the Central East Community Care Access Center, and Dawn will share a few words about how the Change Foundation's dollars will enhance cross-sectoral collaboration in Northumberland. Dawn?
Well, it is indeed my pleasure to join you today and be the representative of the many healthcare providers who have come together to form the Northumberland Community Partnership. As Gail has so eloquently shared, and it's always tough to follow Gail, we know we have work to do. we know we have an opportunity to improve the patient's experience. Each one of our sectors represented in our partnership, primary care, hospitals, home care, long-term care, community representatives, the private sector, our academic partners, we are committed to delivering excellent patient care. And in my opinion, there's always room for improvement. We usually do fairly well as individuals in what it is that we do. Where we fall short, and the incredible response of the Change Foundation's call for interest confirmed, is in the transition points, in the handoffs between one point of the care and another, from hospital to home, from home to long-term care, etc. Regrettably, much of the burden to navigate these points of transition falls to the patients and to their families and to their caregivers. And this really doesn't make sense. Patients, particularly seniors, already struggling to manage chronic conditions and their own failing health, are the least able to at this point in time, to take on the added responsibility of finding their way, their path, through a system that has all too often been designed for the care providers rather than the recipients of care. As a system, we know we can do better, and we know we must do better, as more and more people in the province grow older, live longer, and cope with long-term realities of managing complicated chronic diseases. The goals of the PATH project align well with those of the Central East Community Care Access Center, and we have found with all of the community partners that are involved in the funding of this project. And the funding will make available to us the opportunity to improve our collaboration on behalf of those that we are privileged each and every day to serve. The Northumberland Community Partnership has brought to one table a cross-section of local health and social service providers, and most importantly, the patients and caregivers themselves, who see a very different perspective from those of us who work in the system. While I know that PATH is an acronym for Partners Advancing Transitions in Healthcare, it could just as easily stand for Patients at the Heart, which is really what this is all about. I can't tell you how exciting it was to feel the energy in the room when we met over many weeks to discuss our respective challenges and to develop the proposal that we put forward. And I can't tell you how happy we as the community partners in this are that we are now going to be able to proceed with our vision with the Change Foundation's support. Thank you.
Thanks, Don, very much. And thank you to all of our speakers this morning. You know, Sheila Jarvis used a very important word in her opening remarks, the word redesign. We have an unprecedented opportunity here in Northumberland with substantial Change Foundation dollars to fix and redesign transitions between the parts of the healthcare system that function today in many ways as separate silos. Just as exciting, we're basing that redesign on input from those most affected, the patients and caregivers themselves. This is unique stuff, folks. Not just redesign, but co-design, and it's a first for this province. As such, the Northumberland PATH project promises benefits not only for our community, but for the province as a whole. And again, thank you to the Change Foundation for the trust that you have placed in us. I'll promise you we will not let you down.
So first this one. Yeah, we're going to do this one first. Okay. All right, we're going to try it here. Okay, everybody. Nice. 1, 2, 3. And I'm going to do a couple.